Okie doke. So we have a small audience so far, but I'm expecting more people to show up. But even if they don't, we still have the recording that people can follow later, and those tend to be pretty popular.
Great.
So it's my pleasure, everybody, to introduce Dr. Tom Folan. He and I have been, I don't know, what are we? Twitter buddies, Twitter friends, Twitter colleagues on the cannabis circuit. There are very sadly not very many educated and outgoing physicians who care about people, but also care about cannabis and an educated scientific approach. So we've kind of clicked in that way. So it's a pleasure to have you.
Great to be here. Hi, everyone. Welcome.
So for the folks, Dr. Folan, who don't know you, can you describe a little bit about your background and your connection with cannabis as well as your connection in radiology?
Sure. So, first things first, I'm Irish. You may hear a little tinge of that in my voice, although it's been dulled by 20 plus years here in the US. With that said, I pretty much knew about the same amount, I would say, about cannabis as anyone, in that, had tried a puff here and a puff there, never inhaled, of course, just like Bill Clinton. But really didn't know too much more about it until I was in medical school. And one of my brothers actually became very, very ill. And long story short, turned out that he actually had Behçet's disease, which I ended up diagnosing him with after around about 4 years after he'd been to multiple specialists. And when I say I diagnosed him, at that point in time, I was actually only finished with 1 year of internal medicine residency, whereby I had to do a year prior to going into radiology. And I had seen a single case that my Lebanese attending had shown to us. And when my brother called me one morning with a particular symptom, the alarm bells just went off, and I said, "Oh my God, I think I know what you have." And this will ring true for so very many patients. He had almost been suicidal at multiple points prior to being diagnosed. He was told he was imagining it, and that all these disparate symptoms, which were ranging from ocular to neurological to dermatological, were all, he was imagining it, or there was no real thing. But long story short, I ended up diagnosing him, and it was through diagnosing him and coming to understand his GI predominant symptoms of Behçet's that I found cannabis, and CBD in particular. It was a GI specialist who recommended that we check into this for my brother's tenesmus and frequent feelings of needing to go to the bathroom. Anyway, again, in terms of brevity, CBD predominant cultivars tended to work very well for my brother in just decreasing the inflammation before I even understood what those mechanisms were underlying that. And thus began my kind of investigation into cannabis as more than a recreational substance, but really as medicine. And through that came to really fully understand the full litany of phytocannabinoid medicines and terpenes and all the rest of it that come along with cannabis plant.
Awesome. And what kind of work are you doing in cannabis these days, if any?
Sure. So, initially in launching Solus MD, which I aim to be a platform for three things: recommendation of cannabis, consultation for cannabis, and then free education in terms of the range of products that are available, the endocannabinoid system for those who are looking to maybe augment or enhance their endocannabinoid system without the use of phytocannabinoids. That was something I launched, and through launching it and navigating the various legal and medical considerations that go into launching a multi-state platform, I've kind of refined where I aim to go. So initially, where we had these broad ambitions to offer medical recommendations to everyone, as time has gone on, I've really kind of focused my area of research, my area of expertise, my dealing with cannabis to a certain subset, namely those with glioblastoma, and using cannabis in their treatment, and also in a range of neurodegenerative and neuropsychological conditions. So patients with Parkinson's disease, Alzheimer's disease, and autism spectrum disorder. And again, trying to marry those areas with my particular area of expertise in neuroradiology.
Mm-hmm. Interesting. So, I mean, for the folks who don't know, a lot of the illnesses that you've described, the diseases you've described, are relatively rare in the population, and sometimes it's easier for physicians to find areas that are focused, to be able to dive a little bit deeper, to carve a name for themselves, to make, you know, a really personal / professionally meaningful impact. That's really how medicine has subspecialized the way it has. I've seen some of those cases, but not many. And have you found that the bulk of the cases that you see are those kind of subspecialty cases, or do you see a lot of bread and butter as well?
Yes, that's a great question. I think that the majority of people who are using cannabis as medicine are using it for disparate things, run-of-the-mill everyday things like maybe stress relief, getting to sleep, improving their appetite, things like that. Excuse me. And so the vast majority of patients that I would encounter really are looking for relief from cannabis and cannabinoids for those particular things. But the reason I mentioned the glioblastoma and where my interest comes in there in particular would be that these patients, from the time they're diagnosed, are on average have around 16 to 18 months of life. Many of these individuals have children, or they're younger in life and they have life plans. And there's preliminary research that shows that just by adding cannabis to their treatment regimen, we can get them on average an extra 240 days of life. And for those patients, that is all the time in the world with their children, with their loved ones. Because, you know, I have an aunt who died of that particular illness. My father died of a different type of malignancy, which had metastasized to his brain. And through my work in neuroimaging, I have particular sympathy and empathy with these particular patients. But your point is well received, and I would, you know, certainly urge those watching to let them know that the vast majority of patients who use cannabis for medical reasons tend to use it for chronic pain, again, anxiety, sleeping issues, and to improve quality of life by various methods, whether by improved sleep or for appetite improvement.
Awesome. One of the things that Peter and I, Dr. Grinspoon and I, have talked
Yeah.
about is regular medical life and cannabis life balance. Meaning, from a professional perspective, you know, we have to spend some of our time doing the non-cannabis stuff, and, you know, hopefully more and more doctors are going to be interested in spending some time at least learning, if not practicing, some form of cannabis medicine. How have you juggled that balance between, you know, how much time you spend with cannabis versus time you spend reading radiography?
That's such a great question. And I'm actually wasn't expecting it, but I'm really delighted you asked because, of course, without being privileged enough to have my radiology practice, I really couldn't do what I'm doing with cannabis. Initially for my first year or two, just working in cannabis, every talk I went out and gave, I'm not getting paid. All the hours of research where I'm looking at receptors, and I'm not getting paid. I'm doing this all because I really want everyone to benefit from these groups of medicines in the same way I research psilocybin and other things as well, where it's, you know, as all of us are, it's this thing where you have an MD and you've trained at great institutions and you are privileged to really understand the way things work. And what are you going to do with that knowledge? Are you just going to sit on that, or are you really now going to do what I consider to be the exciting work, where you go and you ask new questions and you look at these substances and you reevaluate them with the technology that you now have that they didn't have hundreds and thousands of years ago? But to your point, it certainly is much like with work-life balance. There is a balance to all of this for those of us who work in cannabis, whereby a lot of the work and a lot of the investigation on that is not paid. And we're chartering territory where we can open ourselves to ridicule, to mockery, to being called drug pushers. And, it's interesting work, but certainly I do have to do, I would say, 60 to 80% radiology work to allow myself the ability to be able to do that 20% cannabis work. And then importantly, what I would add there as well, to those watching who may not be aware, is that we don't just do pro-cannabis work. I'm working with a group right now that's looking at cannabinoid hyperemesis syndrome and the polymorphisms and different components that go into that. So again, it really is all about trying to further our understanding of this plant and of all of the ailments it can treat and which it can potentially cause or be a part of as well.
Mm-hmm. It's actually a very important nuance that I think a lot of people are not aware of. That being, well, and there are exceptions. I'm now realizing as I'm sort of describing it, but we don't have pom poms. We're not here to cheerlead cannabis as this, like, saving grace or holy grail.
Right, right.
You and I and Dr. Grinspoon, and there are a couple others who really take a old school medical philosophy, which is, where is the evidence pointing? Is it good sometimes? Is it not good sometimes? Is it somewhere in the middle? And we are different than a lot of the advocacy groups, which are really there to talk about the inequities of it, and sort of how unfair the world is to cannabis, and what a perfect thing this plant is. And it's a little bit lonely. I mean, I hear you, and I think that's partly why you and I connected so well, is because there's so few of us that that really are trying to highlight the science, whatever it's telling us.
And I think it's great. What I take a lot of comfort from is when I see my Canadian neighbors, a lot of the folks there that I learn a lot from, the geneticists and that. But there's this movement away from the high THC cultivars, where even people who are using recreational are really proving the point that we've known all along, which is that the vast majority of people are not just looking to get high. They really are looking for a way to relax. And, before we got on the call, we had candidly asked each other, how are you doing? And the response was really, as well as can be expected. And there really is this sense nowadays with everyone that folks are trying to cope. And so I think where you and I are coming in, and you very much so as a family practice doctor working on the front lines as a primary caregiver, is we're trying to deal with people who have all these increased stressors, all these increased demands, and they really are looking for answers for how can they cope. And so, as you're talking about with Dr. Grinspoon, who has his own amazing story, and the work you're doing, myself, and a number of others in the community, I feel that we are informed by this approach. We are informed by the harm reduction approach, where we're not just trying to sell you a recommendation. This really is about, hey, is this the right thing for you? How are you planning to integrate this into your life? And how can we optimize it based on our knowledge of the science?
Mm-hmm. Yeah, no, I agree. Actually, just this morning I had a patient who is someone who's in palliative care, so not much time left, and quite sadly, this person had a complete misunderstanding of cannabis. And I'm grateful that they took the effort to come in and virtually to come into the cannabis arena.
Yes.
And I spent so much time kind of explaining the basics and undoing, sort of pulling the cobwebs of all of these ideas from the discussion. That this was going to make someone dumb, or it's going to cause him to feel high and giggly and jump out a window and all these insane things.
Right.
It's an interesting thing because as clinicians, we're trained not just in this narrow kind of dogmatic skill, that we have to really incorporate a wide breadth of perspective and understanding. It's not just physics or chemistry, it's also biology, it's also a little bit of art, it's also psychiatry, and I think cannabis is like that in its own sort of subcategory, that there's so much to it that needs to be cleaned. It's the history component, certainly the chemistry, certainly the sort of medical aspects of it, but also how it's impacting someone's experience of their stress. And today, with the political stuff and the global warming stuff, there's so much else that people are dealing with, that it's a multi-dimensional, it's multifactorial occupation here.
It is, and that gets back into a central point about the cannabis plant, which you and I spend a large part of our day talking about, which is the pleiotropicity and the pleiotropic nature of cannabis, and the fact that it's a quote unquote dirty drug that hits multiple receptors, which in fact is part of its beauty for folks like myself and yourself, where, why is it that the number one age group that's engaging cannabis right now are those over the age of 55? It's because of this pleiotropic nature of cannabis and the fact that it's not just one drug for one receptor. It's the reason why folks like myself and yourself will talk about whole plant medicine and not doing so in a hippy dippy way, but in a way where we're reimagining what drugs really are. Are they one drug at one receptor, or are we really seeing more efficacious effect from these drugs that can hit the 5-HT1 receptor and have GABAergic effects and have dopaminergic effects, and we don't have to wait multiple weeks for them to hit SSRIs. Because this is what our patients come back and tell us. What I find we're doing with cannabis really is we're coming along as the people with medical training, and we're explaining to the people who've already figured out that it works, how it works.
Exactly. Yeah, completely. Well said. No, I completely agree. So you just touched on a bunch of stuff, and I'm quickly writing notes because I want to flesh out a lot more of this.
Sure.
So you'd mentioned psilocybin in our last sort of chat.
Yes.
I wonder where you see the future of psychedelics landing, which is sort of the same thing as asking kind of where does the future landscape look like for cannabis and these psychedelics, whether it's fully incorporated into regular medicine or whatever your opinion is.
Sure. As the saying goes about alternative medicine, if it's medicine, it's not called alternative medicine, it just becomes medicine. I think we're fastly going there with psilocybin, with psilocin, with LSD, with MDMA. Certainly the folks who are watching, who are savvy enough to be watching this webinar, will know about Michael Pollan's book, How to Change Your Mind, the Default Mode Network. This is where we tell ourselves stories about ourselves. I'm not good enough. I don't have what it takes. I'm addicted to this substance. I can't break it. And the metaphor that's used is that psilocybin takes those concepts and shakes it all up and resets the snow globe. And so I think the future that I would advocate for would be a set and setting informed approach to this, where we're not just going out procuring mushrooms and taking them. I think that many of us have utilized that approach in the past, and I'm not saying that it can't work for others in the future, but I think much like Michael Pollan and others will advocate, it's dangerous just to willy-nilly tell people to go out and play with these substances. They're very powerful. And I would advocate anyone who's looking to utilize them, find yourself a practitioner who takes these substances and this subject matter seriously. This is real medicine. And the one particular avenue I would point out is that for smoking cessation, nothing touched psilocybin. With one-time use in one particular study, I believe the success rate was 75%. The next closest success rate we have to that with bupropion is like 14%, something thereabouts. So I think the future is huge, Dr. Caplan. But again, much like we don't want another CBD situation where it's CBD for everything, go to the gas store, pick it up, people are taking mushrooms for everything. These are real powerful medicines. There's real future here. There's companies already banking on it. But with that said, I would always say to folks, please do your research, and set and setting is massive.
Mm-hmm. Do you think the old medical industry, if we can call it that yet, do you feel like they're going to embrace these new/ancient medicines that none of us have learned about in medical school?
I already see the pushback, unfortunately, from the same old circles, some in psychiatric circles. But I also see reason for hope. I know that there's great work being done in Canada with certain folks, Caroline McCallum and others that I'm trying to think of right now. But I think that it will be like anything else, that folks have already been using these substances for quite a while to change their mindset, and that percolating to the surface is what will inform folks. So for example, as recently as 2017 there, the AAMC, the American Association of Medical College, did a study just on cannabis. Something like cannabis was taught in only 13% of medical schools, and that's cannabis in 2017. So as much as folks like myself and yourself on Twitter are talking about these things, and Michael Verbora and other folks have been, I think that it takes for the Gwyneth Paltrows of the world and the Kim Kardashians to mention this, for it to percolate through to the societal consciousness, and then for it to be begun to be talked about, right? Mm-hmm. Rightly so, I think the psychiatrists are going to push back, because they probably see some of the patients who come in after having tried these substances on their own. And so they are looking at it from this perspective. Mm-hmm. And then on the other hand, you have the people who have been through years and years of prohibition. They anecdotally have found success with these substances, and they're saying to the psychiatric community, you need to take what we're saying seriously. Mm-hmm. So I think that it's going to be that yin and yang. That, mm-hmm. but certainly I do believe, as we're seeing with, I believe, Colorado, Denver, and Oakland in California have decriminalized. Yeah, exactly. So I think that we're headed in that direction. But the best thing that folks like myself and yourself, who are scientists and who are advocating these things, can do is to urge caution with folks and say, yes, this is exciting, but let's not get ahead of ourselves.
Yeah. No, I completely agree. I think so my answer to that question is that I think medicine will adopt these things in a long time. I think it will take a while, and I think that's a good thing. I think people should not expect their doctors to open arms to all of these new treatments. I think one of the things that's very special and critical to the safety of medicine is that we take our time, that we evaluate these new things, whether it's a new pharmaceutical or a new plant that's thousands of years old. Any new engagement with human life, we take very carefully and with extreme skepticism and caution.
100%. I think at Hopkins, they had done, over 300 dedicated sessions with trained therapists. And that's the kind of work we need. And as I'm sure you know, Hopkins just opened up a new center for psychedelic research. I believe Berkeley is doing the same thing. And so that's it. That's the great thing that folks like myself and yourself and Dr. Grinspoon are all saying is, we're not actually just saying to people, go out and take these things. We're saying, hey, let's do it. Let's measure it. Let's study it. Let's get the metrics on this. And let's, because we're not frightened of the science. We actually know that there is science there. Much like, we talked about functional imaging earlier on, that's how they kind of discovered an awful lot about the default mode network. We put these individuals into functional MRI scanners, and we watched what started to happen. And we saw that there was all these increased activity in different parts of the brain when they were just lying in the scanners with nothing going on. And that's how we identify that that's where you go when you're like, oh, I wonder, did I pay this bill? I wonder if my wife will be mad at me because I'm going to get home late. That's where you go to ruminate. And they saw all this increased activity. And then after the psilocybin, they saw that activity way down. And, it's curiosity. It's thank God for the people who put these people in scanners and who have the intellectual curiosity to ask these questions. And that's how science progresses.
Mm-hmm. Mm-hmm. Yeah, it's an important area of study. And it's something actually I highlight with people a lot, is that, this is not he said, she said. I mean, these days, there's two unfortunate sort of situations. There's one which is anecdote, and everybody's talking about it, and it's actually great because we want the word to get out.
Right.
But it doesn't seem dressed up. It doesn't seem professional. It doesn't seem official. But then there is actually official study. We have hard evidence that there's benefit, that there's clear differences that are helpful for these very sick people. Between consuming cannabis or another substance and not.
Right. And one of my favorite areas of research or findings to come out of that particular line of study was that 5 years later, you could take these people that had been through this experience one time, and there was lasting benefit. So to the skeptics out there, that's what I would say. And what I'm finding increasingly is that these aren't skeptics. You can joke about DMT or MDMA or Molly or, any of the cannabinoids now. and people know what you're talking about. People are correcting each other. I'm watching this, there's this boat show my wife and I watch on Bravo, and they're like correcting each other, and that's THC, that's not CBD. I recognize that pen, but it's just watching this sea change occur. My mother, who's in her 70s, is now like a loyal cannabis convert and had gone her entire life thinking, these are drugs and whatever else. And her particular remedy that she enjoys would be a 2.5 to 5 milligram edible, which she can now enjoy off the legal market in Illinois, where she lives. But it will just go to show you that this is a woman who had 9 children. To her, growing up, cannabis and cannabinoids were drugs, quote unquote. But this is where we are. So I would say to those people that think that we're putting cannabis back in the bag or psilocybin back in the bag, get with the times.
Yeah.
You know,
No way, Jose. Right. No.
no way, Jose.
So actually, I mean, you sort of bring up an interesting question for me, which is just highlighting what you said. As a radiologist, let's call you wearing radiology glasses, from that perspective, that education. What are some of the big lessons that the radiology glasses have told you about cannabis?
Sure. So, this is where we get to the part of the talk that everyone who's listening, some folks may not agree, and I apologize in advance if you are under the age of 25. But much like with alcohol or anything else, in an ideal world, what we would say to everyone is that, during the teenage years, you're forming all kinds of connection between very important parts of the brain. The anterior cingulate cortex, the ACC, would be one area that frequently comes up in cannabis imaging. And it just kind of shows that, if you have heavy sustained use of cannabis during these years, that there can be some functional disconnectivity or potentially some impairment that is long lasting. And this has been borne out through the work of Dr. Stacy Gruber, as we were talking a little bit about her work. She's fascinating for anyone who's watching who's not familiar with her work. She does a lot of functional MRI work out of Harvard. What was also very interesting in Dr. Gruber's work is that when she then turned her focus of attention onto those who use cannabis medically, let's say, into their 20s for a defined entity, whether it's chronic pain or something else, that at the 3-month mark, these patients had improvement on their functional MRI scans to show that they were less focused on their pain and other findings. So it's always very important, who are we looking at in terms of what are we studying? The other thing I would encourage people to look at is who's funding the study, and that we've had a lot of very negative studies looking at harms and structural differences. In other words, is the brain losing volume? Is it gaining volume? And even as a neuroradiologist in preparation for this talk, I went through a lot of the neuroimaging, and the first word that comes up is conflicting. Okay, so you've there was increased blood flow, there was decreased blood flow, they gained volume here, they decreased volume here, they gained volume here, but we don't know what it means. Because typically when you think about gaining volume, you think that's a good thing. But one of the recent studies came out that showed that people who use cannabis gained gray volume, which you think, again, you would think this is a great thing, but we don't really know what it means. So I think that what needs to happen is that as the US and other countries gain more sensible attitudes towards these substances and understand that folks are going to use them, then we get more and more unbiased research, more well-powered research, where we can really understand what these sometimes disparate and conflicting imaging results mean. That's what I would say. Then we could get into CBD research, where there's a lot of research that shows that this could be a potential boon for psychosis, and that it antagonizes the effect of THC. So there's a whole load of neuroimaging research, but it's quite complex, and we could talk for hours about it.
Yeah, I think my comment on that, and I have a request, I guess, to be more specific with one thing.
Oh, sure.
The CBD stuff, I think, it's my hunch, my intuition is that it's going to be more on the preventing degradation side than on the CB1 receptor antagonism side. That there's probably something aggravating a normal system on the lack of degradation side, with buildup accumulation because of the antagonism. But it's purely out of my gut.
Right. Yeah, and there was that research that came out in a murine study looking at that ERK dependent mechanism, and that CBD dampened that effect. And it's pretty interesting that they find that CBD given alone has no effect on volume, but when given with the THC, it decreases the effect. So I'm right there with you.
Yeah. So I wanted to make sure that our listeners understand chronic and heavy use leading to long-term ACC damage, ACG actually. What does that mean?
Sure. So what they're finding is that in certain parts of uh, your frontal lobe and with its connectivity to certain other parts of the brain, the ACC, for example, that you might have decreased connectivity from, chronic heavy use. Now, this was in folks who were using daily or greater than 4 times a week. So whenever you look at these studies, first look at how were they defining use. And also these were individuals who started using in their teenage years. Because again, in other studies that looked at these things in individuals who were using later, they did not find this decreased connectivity. So what the idea would be that when you're basically using substances that can affect connectivity between parts of the brain that are still developing, that those effects can be long lasting. So just the central point again, that be to abstain from everything until the age of 25. And if you can't abstain or choose not to abstain, just to bear in mind that these findings are known and that you are, taking a risk. But it's like with everything else. When I give these talks, I talk about how 100% oxygen is toxic, so the idea being just make your decisions accordingly.
Mm-hmm. Yeah, no, of course, and this is an area where we differ, I think, and I think there's no right or wrong. I counsel all of my pediatric patients, and I do have a bunch of pediatric patients, that these decisions are choices. Nothing in life is without risk, and when someone is not able to sleep or not able to function because they're so stressed out, or they're not able to go in public because they're so embarrassed about whatever autoimmune symptom they might have, the potential downside of cannabis might not be such a big deal relative to the suffering they're experiencing with their illness. So just like you said, it's always risk benefit.
100%. Like, I couldn't agree with that more. That's exactly it. Some folks would be like, "Oh, Tom, how can you work with these parents who have children with autism spectrum disorder and you give them THC?" And I will quickly let them know that those parents will report that the first time they gave their child THC, that child looked at them and smiled for the first time. And it gets back to this whole idea of, what if the patient is high? A couple of years ago, we had Purdue Pharmaceuticals telling people that you can't become addicted to opiates if you really have pain, and all this other things. And we're here worried about people potentially feeling good about themselves after THC. It's so ridiculous. It's how this whole thing has been sold, and the stigmatization, and
Right. No, I mean, that's a common topic, for me too. I think the demonization of joy is criminal. I think, and it's somewhat cultural. I'm not necessarily blaming it on the medical culture, but although, we have made decisions to make medicine, taste bad, that, the sort of puritanical thing that, healing should be a godly thing, that we shouldn't be, embracing hubris that we solve all problems. But the idea that people shouldn't feel happy, and it's artificial, and who cares? I mean, it's so silly. We're okay with children feeling joy, but as soon as people grow up and have a job and have their own children, heaven forbid they have joy.
That's exactly it. And it's very interesting, this whole COVID-19 thing. I was reading the last day a study about physicians choosing not to go back to medicine because they had discovered that in their time off with their families, these were the things that really mattered. And for the likes of myself and yourself, who tend to ask these questions, we wonder about lifestyle medicine, and we try to devote part of our time to cannabis because we're intellectually curious. We had already kind of discovered these things. We tried to reclaim some control over our careers and our intellectual curiosity and what we're going to do. But people are discovering these things more and more, where, they're like, you know what? I'm going to enjoy sex. I'm going to enjoy a day off and not feel bad about it. I'm going to enjoy a 5 milligram cannabis edible. Who cares that I was told that this, oh, it'll get you high. But meanwhile, we're giving people Xanax, we're giving them Ambien, we're giving them these other things where I mean, it's ridiculous. Anyone watching it, it's as ridiculous as watching the US political system and thinking that it's the adults. Like, these are not the adults, so it's like anyone else trying to tell me about, oh, cannabis is a drug and, oh, you should just take your opiate or take your gabapentin or take your whatever. And I just started laughing at them like, I'm actually trained in these things. I understand how they work. And I think you're wrong.
Mhm. Yeah, no, yeah, it's a very frustrating situation to be in. But I think also it's important for us to remember that the confidence that we have with pharmaceuticals is artificial. It's imagined. We shouldn't. We think we know what this is doing, and then the swings of medicine where salt, even just salt, has been good, and then it's terrible, and then it's not so bad, and same with vitamin D and all of these sort of basic elements of life.
The histamine blockers, it just came out a couple of months ago or a year ago. They increase your risk for dementia. Right. So it's like, forgive me, 1 minute coffee is the best thing. The next thing, that third cup of coffee is going to kill you. You go back to lifestyle medicine. Initially, one of the questions that was, I was laid out for this is, well, what's lifestyle medicine? And all I would say to lifestyle medicine is, and anyone can practice it, it's common sense medicine. It's cutting out stress. It's eating right. And this is where cannabis comes in, and that, as we're all well aware, DiMarzo et al. Said the endocannabinoid system is responsible for 5 things: to eat, to sleep, to relax, to forget, and to protect. So to me, any physician that is ignoring those things, what kind of a physician are you? Because, I just did a year of internal medicine, and you want to know how a patient is doing, find out how are they eating, how are they sleeping, how are they stressed. The most basic things. And I'm sure some people have to be watching this laughing like, this guy's a neuroradiologist. He's like Scott Atlas, But at the end of the day, what I would say is, before I'm a neuroradiologist, I'm an MD. And the most basic training is, are people sleeping? Are they eating? What's their stress level? And if you can answer those 3 things about someone, you know quite a bit about them. And in my entire time with cannabis medicine, that's the part it really gets at with patients, is in that right there, where it improves their quality of life. They're eating better, they're sleeping better. And I don't need the RCTs to tell me that. I listen to my patients.
Mm-hmm. Well, and I have special bone to pick with randomized controlled trials, RCTs, that we in the scientific community have also forgotten that science is based on doubt and skepticism, and p-values are not chiseled in stone. This is a line in sand, and it's not telling someone how life is. It's telling how one study is, and there's always nuance to study that we probably have missed something essential in every study. I mean, it's the love that we've fallen in with our own genius is really intoxicating and foolish.
Right. And how do you control for something which controls the placebo effect? Right. So it's just, but this is the great thing with cannabis. And, as I'm sure, again, someone like yourself will agree, is that the more we learn, we're still learning. And that doesn't frighten us. But again, we live in one of 2 countries in the world, the United States, New Zealand, where there is direct to consumer marketing. Ask your doctor about the purple pill. It's kind of hard to ask your doctor about the weed that you can grow in your backyard. And as much as I'm not a conspiracy theorist, but as the saying goes, it's not conspiracy if it's actually happening. Mm-hmm. It's not paranoia if it's actually happening. And again, the United States is one of 2 countries in the world where you are allowed to get up on that television and market directly to that consumer who has no knowledge of medicine. And again, someone like me, 14 years of training after high school. It's not because I'm stupid. It's because there's an awful lot to know. So if there's an awful lot to know, why would you be marketing drugs directly to consumers? Because they don't want people to know. They want to tell you what to ask your doctor for, and for you to go in there and ask your doctor for it. And I'll never forget, Last thing I'll say, but when I was in medical school, my favorite professor, she was a pharmacology professor. And at the time, Brigitte Nardell was her name. She said, you can tell the health of a society by looking at what drugs they're on. And she said, look at American society. What are they on? She said, they're on Ambien, they're on Viagra, and they're on Prilosec. She said, so they can't eat, they can't sleep, and they can't get it up. And she says, that tells you everything you need to know about that society.
That's really interesting. I love that.
Absolutely. I thought so too. This lady was an MD, PhD from, I believe, Hopkins and Harvard, respectively. Brilliant lady. But she used to always encourage us to enjoy our lives. She's like, you kids in here studying, you need to get out. And then she'd say, this society is a joke. You look at it. They can't eat, they can't sleep, and they can't get it up. And she wasn't far wrong.
Yeah, no, it's really interesting. Bouncing off of that, thinking about the patients that you've interacted with cannabis, what are some of the most amazing, most memorable, most lasting impressions that you've received?
Sure. So one patient straight away comes to mind. His name is David. And David was the first patient I ever took on with a glioblastoma diagnosis. And I just remember one day getting a text message from his wife after they had been to Heathrow Airport in London and had gone running down the terminal in a wheelchair with vaporizer pens and syringes packed with all kinds of illegal substances because, of course, this man was dying and he had a pre-planned trip to go to London. He was working with world-class neurosurgeons and neuro-oncologists who knew of his plans and his escapades and that he was going away and that he was taking his cannabis medicine with him. And they just didn't care. I cannot admit or deny whether I knew anything about these plans for legal reasons. But suffice it to say that at his Shiva, after his passing, just recalling these stories with his family who were so thankful for the help we were able to provide and for the time with him and his family, and for giving them these stories where even for that entire family and for the children, they knew this was their dad's medicine and that it wasn't funny, cannabis. But these types of stories will stick with me, and the gratitude of the patients.
Can you talk a little bit more about the relief of suffering that he experienced with cannabis?
Certainly. So David was in his 40s when he was diagnosed. He had 2 children, and he was, up until that point, a very active and loving father, member of his society, and kept a job. But as he underwent the various treatments and with cannabis, cancer recurring, and just getting bad news after the scans, the cannabis helped play a role in his day-to-day anxieties, his facing his own mortality, his improving his appetite and quelling his nausea when he was going through various stages of chemotherapy and radiation. And just as a kind of a glue that gave them some hope, David was traveling up and down to a national recognized cancer institute at the time. Sometimes it would help him go to sleep just when anxiety was really, really high. So in a multitude of ways, in ways that he wasn't really expecting, it was a crutch for him and for the family, and gave them hope as well. That they could get this extra time with their family when, not to knock conventional medicine, but conventional medicine had what it had, and this was, just offered hope, which is a very important thing for many of these families.
Mm-hmm. Hearing you talk about him brings up something in my practice of cannabis medicine, which is very hard to share with anybody else. It's something to do with the physician-patient relationship, and it's something so special and so holy is really the only word I can come up with. I have, I've been blessed with caring about people at the end of their life as you have too. And the opportunity to teach them and to help serve them and guide them with something which is giving them these people who are suffering or who are in pain, physical and emotional, to give them levity, to give them relief, in a situation where they can't ever repay you. That it's such a giving experience, and it's so immensely gratifying, that it makes, I mean, that's why I became a doctor, was to be able to have those moments where you're giving to someone in such a special, spiritual, human way. Can you talk about sort of that element in your experience and what cannabis has shown you? Because I think people outside of our offices don't understand, that, and not just that it's more than cards, but it's these moments in a clinical scenario where you're touching someone, you're reaching someone, you're helping someone in a way that nobody else really can understand.
Yeah, it's so true, right? Like we talked earlier about the balance between our, quote unquote, day-to-day jobs and then what we do in this particular realm. And I won't forget getting the phone call from my brother one evening about a family friend. And I had actually labored as a bricklayer on this man's house. So when I was around about 21, 22 years old and applying to medical school, I was working with one of my brothers, and I was a laborer on this gentleman's house. And it turned out that now, some years later, his 30-year-old daughter had terminal breast cancer, and he was calling me for a consult on her. So just going over to her house and sitting with him and the family, and being allowed to enter that space that you talk about, and being so privileged to be a part of that, and them really looking to me for anything. These are the moments that when people ask me, would you become a doctor again? What do you enjoy about being a doctor the most? These are things that it's very difficult to share with people, but the trust of that family, the immense gratitude, the phone call after she passed, letting me know that what the role I had played, these are things that it's very difficult to translate to someone else or to impart to them what it's like to be that individual. But to stand up for that patient, to do for them what you would want someone to do for you, to give you something that could perchance increase your mood, decrease your nausea, decrease the pain from the mets in your bones that were causing you to be awake at all hours of the day and night. And just have that patient thank you and make that eye-to-eye contact, and really one human to see the other. Any physician or practitioner that gets to experience that knows what that is, and will never forget it.
Yeah. No, I think that's what being a clinical, well, being a doctor used to be. I think more than, where it has devolved into these sort of bureaucratic ecosystems that are driven by bean counting and insurance groups. And it's all about the money, and it's all about this turnstile medicine where people are shuttled in and out. The doctor has no relationship with the patient. And you brought up the COVID stuff and how that's affected things. It's interesting because I think it's a, one of the silver linings, obviously, of COVID is that it's an antidote to it's a wake-up call, maybe is the better expression, that a lot of clinicians have forgotten what it's like not only to have a home life, but to see what really matters in life. That some of it is, some meetings could be done over email, and really should have, and how much time we spend in the hospital, in the clinic, doing extraneous work. But what really matters out of life, and to see our patients, who are suffering immensely, and they're trapped. They're trapped at home. They can't, for the most part, go into the clinic or the hospital because they're scared of getting sick on the way. It's an eye-opening experience that has brought a little bit more humanness, a little bit more kindness and compassion to clinicians and all doctors. I guess that's more of an observation than a question.
Well, it's a good observation. I do think that, oddly enough, to coincide with that, to build upon that observation, cannabis use has been up during COVID-19 because people are at home more, and because people are, reevaluating what's important, potentially, and I want to be careful with that. I'm not trying to say that, oh, cannabis use is up, this is a great thing. We certainly don't want more people addicted or using these things in a deleterious manner. But to the point that has both been obvious to me from myself and talking to my own family members who are spending more time with each other, and then to the articles that are coming out that are showing that this is a national and international phenomena, people are really beginning to, evaluate, like, first off, do I need to be commuting to an office 5 days a week? Do I need to be spending 2 hours of every day stuck in traffic? Do I really like this job? Should I be working for myself? Do I need to be on these 20 medicines? Would 15 maybe work? This type of thing. And even back to, the archaicness of medicine and state licensing. Why is it that I need 7 different state licenses, but that in a pandemic, that can all be done away with overnight? Maybe that didn't all need to exist to begin with. So I think that in many different ways, all of us are asking a lot of questions about the fundamental nature of the way things were, and do we even want to return to that?
Mm-hmm. Yeah, it's a revolution, I think, on so many different levels, and hopefully we'll all rise. So I want to sidetrack because I have a couple of questions that are coming in through social media that people want to ask you.
Sure.
This one we sort of covered, but not really. So there's no reference whether it's your radiology experience or your cannabis sort of professional life.
Sure.
What part of your field needs the most attention with regards to process development? So I guess what's improving? What do you think needs improvement, either from a medical cannabis perspective or radiology?
Sure. So if we talk about it from the cannabis perspective, I think obviously descheduling cannabis and allowing the floodgates to open on research would be huge. For anyone who's watching who's not aware, one of the huge issues with cannabis research has been that all of the cannabis that is federally funded must be provided by the University of Mississippi, and their cannabis is more in keeping with swaggy 0.3% hemp than it is with these 28% THC cultivars that we're finding in dispensaries around the country. So what people like Dr. Caplan, Dr. Grinspoon, and myself are advocating is that we can actually do the research with these particular products. So that would be a big one on the cannabis front, is not that we're afraid of the research. We want to do the research, just allow us to do the research with the things people are using. Mm-hmm. And then with radiology, in fact, it's a great kind of segue question, because AI is a big buzzword, neural networks, basically artificial intelligence that can teach themselves. These things can be leveraged so that we can really understand any number of topics, whether it's looking at cannabis in real time or whether it's identifying tumor recurrence completely independent of cannabis as a topic. Mm-hmm. For example, there's research that shows that AI can already do that better than neuroradiologists like myself on a voxel by voxel level, so that the computer can take a look at each voxel and tell if there's cancer recurrent in that voxel, where the human eye cannot do that. Mm-hmm. So in both areas, there's tons of work to be done, but things that can be leveraged, AI can be leveraged to both facilitate our understanding of cannabis and to further our understanding of neuroimaging and advancing the cause of radiology.
To tie those two in, for those of the people who happen to watch, I'm actually bringing in artificial intelligence and machine learning into cannabis education and crowdsourcing of knowledge. Not just from the medical literature, not just from our experience as clinicians, but from what people are experiencing. Bringing in all of that data into a singular learning engine.
That's amazing. I know our friends in Canada are doing that as well. What is that company I'm thinking of that has been gathering all that data? Strain Print, is this correct?
Yes, sort of.
Sort of. Okay.
Okay. They're somewhere on that path.
Okay.
Put it that way.
Yes, okay, good. Well, no, that's amazing. I'm delighted you're working on this, because certainly this, these things are buzzwords, but they do mean things. And we kind of joke about it in radiology because everyone's got an AI company. There's so much hype. But then also, there are FDA products rolling out, and like aidoc.com, which is one of those. These things are getting FDA approved. So certainly these are bright and burgeoning areas.
Agreed. This next question, what resources do you recommend for someone who's trying to learn more or educate their physician?
Sure. So this is an interesting one in the sense we ourselves are trying to build these resources. I know the CED clinic has excellent resources. You've got a wealth of papers there. As terrible as this sounds, Twitter is a great resource, because where else can you really interact with physicians, with scientists who are doing this type of thing day in, day out? Learning the different players there, like Saoirse O'Sullivan is a fellow Irish individual. She's in England at the moment and is always churning out excellent research. Matt Hall out of Canada and his group. So really, I educated myself in all these things by just getting onto Twitter, searching cannabis buzzwords, learning who the different players are, Dr. Caplan, Dr. Grinspoon, and following these folks. And then also importantly, following the folks you disagree with, following the prohibitionists, following the folks who work at NIDA, Kevin Sabbath, and all these other folks, and seeing what these arguments are. And those would be good ways. What else can I say to you? Really Google. When I started a couple of years ago, what I did is I just went and I created a document, and within a month I had 80 pages of documents and links, and I had to go and pull all this information together. And part of the kind of struggle and in trying to create my company SolaceMD, in that it has been trying to create this central repository where people can just go and be educated and learn all about cannabis. But of course, as I started to educate myself and delve into all this, I just kept learning more and more. And then the creation fell to the sidetracks, and I just became, a consummate educator. But that is what I would say. Unfortunately, there's no great one central resource. Look at Mara Gordon, look at Ethan Russo, check out what they're doing, what organizations they're involved with. And if you have done all that, you should have a good start as to being educated as to cannabis.
Agreed. What do you see as the biggest barriers that people have to getting their hands on effective medical cannabis?
Sure. So I think that, we all had a very great lesson recently with the vitamin E acetate vaping scandal. And for those who aren't familiar, that's where a number of people died. And you probably heard of it as the vaping scandal. But of course, the vaping scandal really means that because we had these substances illegal on a federal level, and we didn't have state-wise mandatory testing in place for these substances, individuals who were interested in profit were cutting these cannabis oils with these terrible substances, and people were dying of lipoid pneumonia and more. So what I think is really important in the interest of public health is that we work on legalizing these substances federally, that we tax them appropriately, so that we don't have a situation like in California where 80% of sales are off the black market, but with that, where we do it, where people are like, yep, that's worth it to me. And then that importantly, that we take that tax money and reinvest it back into education and into testing. And so that then we have a safe supply for people, and that we have an educated populace.
I agree. We also covered this last one, I think, to some extent. What, in your opinion, how will the industry look after it's decriminalized?
Sure. So how I would like it to look like would be it's interesting, right? If you look at Canada, you had all these big players, many of whom actually fell by the wayside or had all kinds of various scandals occur. So what I would love to see happen is, ideally, I would love to see it such that with cannabis laws, everyone could grow their own, everyone could become educated how to make their own oils, that there would be a thriving marketplace alongside that of hopefully mom and pop stores that would provide artisanally batched, locally sourced, pesticide-free organic goods that were certified and tested, that we just didn't have these monopolies, the so-called Amazons of cannabis, and where we were all forced to buy their products. But again, as the lessons of the past couple of years are teaching all of us, we need to fight against these systems that would have everything monopolized and have all of us just kind of, slaves to these monoliths. So ideal world, these would be the things I would be pushing for.
It's interesting. I answered this question in another talk recently. I'm having different thoughts now. I think I sort of agree with you. I mean, I encourage people to grow if money is an issue to them, and some dispensaries, especially in this state, are quite expensive. And the caveat I always draw to people's attention is, even in the best home grow scenarios where someone's buying organic soil and using organic ingredients and being very careful about what they're doing, cannabis is a vacuum of microtoxins. It's one of these plants that's used to treat toxic kind of dump places.
It's true. It's true.
And even those organic, meticulously clean grow nutrients can have small, fine problems. To say nothing of mold and bacteria that can be much more plentiful at home than they would be at a legal sort of state-sponsored dispensary. And I think to some extent, a little bit of badness is not a bad thing. That we have this ultra clean, sterile culture that's probably got some problems associated with the sterility. But I wonder if too many people are growing at home, if the quality becomes dangerous. What do you think?
I think that's a great point. And one I'm quick to mention, I'm glad you brought it up, is that I certainly don't think it's the case where the vast majority of people are going to be relying on that. You want to have a system where it's healthy, where folks can access the medicine they need through a clean supply, a reliable supply, so that they're getting the same medicine every time. But more my point was that I want to have it such that I'd seen cases where in certain states, certain commercial entities were pushing for the laws such that home grow wouldn't be allowed. And it really seemed to serve their particular interests. And a narrative was pushed that it was in the interest of the patients. And just, forgive me for being a little, having a jaundiced eye or being a little cynical, but so just in the interest of that, in the spirit of the plant and what the plant has always been, I would hate to have a scenario where you could access this medicine, but only if you did it through, these particular mechanisms. Certainly, though your point is well raised that, cannabis is grown on the site of radiation poisoning because it leaches up all the toxins so well, so that you really want to be very careful with that kind of concept. And that's why it's so important as well that we have a legalized market, because people are just buying off the guy down the street. That cannabis can have been grown anywhere. And unfortunately, these people's best interests are not aligned with your health. It's just in getting you to buy their product.
Mm-hmm. Yeah. No, I have literally seen pictures of patients brought in of someone growing weed in a shoe, like in a boot. I think it was a joke on that Wall-E movie.
Right.
They were, they're literally growing it in such filth. And most people who are growing on the street are not formally trained botanists or horticulturalists. These are people who are really trying to eke out as much money as they can from people. Like you were alluding to, the vape stuff, was because people are cutting product to make more money.
Right.
These are not people who are interested in someone's health and well-being at the expense of their profit.
Right. Yeah, exactly. So that would certainly be it. Just pushing for more access, more education in all the various formats that can occur.
Here, I'll throw you a scandalous loop. Do you think we should put the regulatory power into the hands of the U.S. government, the national government?
The national government, I think that's a very dangerous proposition, particularly in light of the past 4 years.
Right.
I think that we should, after hopefully the next 5 days, something changes, but that we should probably have a bit of a discussion about the entire setup of the government. I mean, without getting overtly political about it, to my mind, what has transpired these past 3.5 years was heretofore unfathomable. I remember sitting in a political science class and just being regaled by this instructor about the checks and the balances of the US system and the Constitution. And what I would say is that the past couple of years have shown us how incredibly weak and how incredibly susceptible to attack and to autocracy the federal system is. And I'm very thankful that we have the states' ability to push back certain states such as California and New York have.
Yeah, I completely agree. I think with respect to regulation of cannabis, my vision is that it is all decentralized and made state specific. I think regions of the country are very different, and that's okay. I think to your point we've raised many times, it's differences are good. We need to disagree. We need to learn from one another. Change is good. I think as different states develop different policies around cannabis and what they're comfortable with and what their constituents want, I think that makes more sense. I think there should be some national standard of safety and quality of product, I guess. I don't know quite what that means yet, but it should be something that's uniform and make sure that everybody has to be safe. But then things regionally can be somewhat different or within, build different fences around that.
I agree, and I think that allows for a very nice kind of incubator model as well, where whatever works in one state can then be adopted. And even to that point, I see there recently last week, California had enacted some policy to allow the banking to kind of progress there. And so it's like within climate change and environmental law, that it's good to sometimes have this situation where one state can be the incubator or the test tube for that particular idea, and then take that nationally once it's succeeded.
Yeah, awesome. All right, so we've actually, I blew right by the 8:30 mark. This has been awesome, Tom. It's a pleasure to talk to you, and I hope other people feel the same honor to learn from you and to be a part of our discussion. Thank you.
Yeah, hey, thanks very much for having me. This was really enjoyable, and like you're saying, I really didn't feel the hour going, and I'm glad we kind of did the conversational format. It tended to work well, I think.
Yeah, no, I agree, and hopefully we'll talk again soon.
That sounds great. All right, Ben, thanks very much. Cheers. Take care, everybody.